Live, move, and have your being with Baaba Cofie.
So, welcome once again to the Live, Move, Have Your Being podcast with me, Baaba Cofie. Today, we are talking on a very sensitive topic. It's male fertility. It takes two to tango. Is that true? And how true is that? For far too long, conversations about infertility have been framed around women. And why is that? The truth is, fertility is also about men. And that's what we want to talk about today. Research shows that male factors contribute to about 40 to 50% of all infertility cases globally, and this is from the World Health Organization. So, in this episode, we want to break the silence and talk openly about male fertility. We want to talk about the stigma that men might possibly face and why they coil easily, when we talk about male fertility. We also want to understand how these medical conditions come up, what are the factors, etc. So you would hear things about diagnostic options, like semen analysis, hormone testing and imaging, plus some treatment options such as IVF, IUI, ICSI, etc. Beyond the science, we also want to talk about the emotional weight that male infertility carries on couples and why it takes two to tango. So this conversation is not just about medicine. It's about men, it's about couples, it's about families reclaiming their stories without shame. And once again, I have the pleasure of introducing Dr. Joseph Homiah from Accra Fertility Centre, one of the hospitals under the Medifem group of hospitals. And he's here. The last time we spoke about IVF, today we are talking about male infertility. Doc, you are so welcome.
Always a pleasure to be here.
Great, thank you. He's had to make a lot of sacrifices to be here, and so we can only be grateful and thankful. So let's get straight into the conversation. We want to understand male fertility issues. Can you explain some of the common male fertility issues and the causes?
Yes, basically, before a woman gets pregnant or achieves conception, three basic things have to be there: an egg, a sperm, and a womb. Without these three, it's not possible to achieve conception. But the male side is a sperm, and without a sperm, there cannot be any pregnancy. But for a long time, over years, we've always blamed the women that every man is supposed to be fertile. Once he can have an erection and once he can have sex and ejaculate, you're supposed to be fertile. So if the partner is not getting pregnant, then obviously she's got a problem. But like you said in your introduction, research has shown that things have changed. When we were in medical school, we used to say 30% male, 30% female, 30% a combination of the male and female, 10% unexplained as the causes of infertility. But now we seem to, or the data points to the fact that it looks like it's actually about 50-55% male. So this topic is quite relevant. The other thing is that the male partner is the most difficult to deal with because if you go to any fertility units or even an antenatal unit, I mean, if you see 100 women, you see maybe 2-3 men who are going to accompany their wives. So they will say, oh, go and test yours and come, I'm fine. And that's the culture. And I think after this program, it should change.
We hope so. So what are some of the causes?
Yes, for a man to produce sperm, there are three main parameters that have to be intact. It starts with the brain. there's a part of the brain called the hypothalamus that produces like the hormones or the signals. Then it goes to the testes. So that's like the factory where the actual sperm is produced and stored. Then, of course, to be able to impregnate the woman, it has to come out through the ejaculatory ducts and the penis and all that. So any problem along any of these three lines can lead to poor sperm count quality and, of course, infertility. So these are the three main areas that, of course, lifestyle, which we'll come to that later, can also affect it, yes.
Exactly. So I'm wondering, how does lifestyle support this? Maybe we should look at things like age, diet, alcohol, smoking,
Yeah.
stress, and all of that. If you can explain how.
Yeah, I mean, generally, I mean, globally, studies have shown that male counts are going down. If you compare from the 50s, where data has been collected, there's a decline in the male sperm counts. If you look at like 1970, the normal typical man would have about 100 million sperm per ejaculate. But if you look at 2020, you're looking at only about 30 million
Wow.
per ejaculate. This is worldwide. This is not pertaining to Ghana. Can we have the second slide, which also depicts the same thing? And this is like 1973, how the counts were so high. 2011, almost 60% reduction in sperm count. So this is not a Ghanaian phenomenon, it's a global phenomenon. And a lot of things have been attributed to it, environmental factors, pollution, insecticides, pesticides.
Oh, really?
Now, plants that are supposed to grow over 6 weeks can be made to grow over 2 weeks with all sorts of chemicals, anabolic steroids, and of course our lifestyle, smoking, alcohol, illicit drug use, and all that. All these have led to the drastic reduction in counts. So the 1973 man is far fertile than the 2011. And I'm sure if you draw the graph to 2025, it will come lower. I don't know when it will come to zero.
Oh my goodness. Wow.
There's another graph I have on the studies done in the US. And it shows that 2023 is the all-time low in terms of fertility for males. The counts have gone from 120 million per ejaculate. What it means is that when a man ejaculates one, he produces 120 million sperm
Wow.
at a go.
I see.
Yes. But now, on the average, about 54 billion.
But if 54 million is still a lot in my layman's mind, so why is it, why are we seeing low sperm counts? Or at what level is the sperm low or too low?
The myth is that you just need one sperm to fertilize, and like that's not necessarily true. I mean, if you're using artificial technology, then you could use that. But you need about 50,000 sperm to surround one egg for fertility to occur. And after sex, when the sperm is deposited in the vagina, it has to swim all over through the womb, through the fallopian tubes to where the eggs are. That distance, if we were to compare in terms of landmark, is like from Cape Town to Egypt.
Oh, wow.
It's quite a long distance.
I see.
So a lot of the sperm will fall out of the way because they don't have the capacity, they can't swim, they are not morphologically normal. So a lot of them will fall out of the way. But this 54 is for the average. But there are lots, like you mentioned, the WHO study, almost 42. There was a study that was done in Nigeria where 42% of men didn't pass the semen analysis. 42%.
That's a lot.
That's quite a lot, yes.
Wow.
You know.
Are there also some other conditions, maybe genetic conditions, infections,
Yeah.
things like that?
Yeah, there are genetic conditions that forms about 5 to 10% of the causes of male infertility. Some males, the normal typical male has chromosome XY. Some males are born with what we call XXY, so they've got an extra X. So those males, if you look at them typically, they look feminine. They don't have facial hair. Some of them have what we call gynecomastia, like enlarged breast and all that. And when you check, you realize that their sperm counts are quite low. The other common ones is mumps, mumps or when you get mumps, especially during your adolescent years, it severely compromises your sperm counts. Any medical condition can lead to low sperm count: kidney failure, renal failure, thyroid problems, and all that. Then infections like gonorrhea, chlamydia, tuberculosis, and all that. Because once the sperm is formed, it has to come out. It cannot come out if there's an obstruction along the way. So even though the man might have sperm in the testis, is unable to come out for conception. And sometimes too, there are other issues like erectile dysfunction. You can have the sperm, but if you can't get erect for you to ejaculate, you're not going to impregnate the woman. Some no sperm will come out at all during sex. Some where the typical opening of the penis is, where the sperm would come out, some men don't have it there. It's abnormally located. So during normal sex, he would have thought maybe he's put the sperm at the right place, but it's probably on the bed sheet. Then there are some men who are born with what we call undescended testes, especially kids who are born premature, less than 35 weeks, because the testis normally starts from the abdomen. And during your time in the mother's womb, as you get to maturity, it comes out to enter the scrotum. So if the baby doesn't reach that maturity point, it could get stuck either in the scrotum or it could get stuck in the groin. And other parts, sperm generation is very poor. And some of those might present as hernia. The mother might think it's a hernia, so take it to a doctor for it to be repaired. And by the time he's done, he's actually removed your testis. Yes. And kids are also predisposed to hernias already. If you are repairing a hernia, because they are small and their tissues are very thin, you might not be able to differentiate all the tissues, what we call the vas difference. The vas difference is what the sperm passes through. So during the course of the surgery, you might tie up the vas difference and, of course, render her not impotent but unable to produce sperm.
Wow.
There are so many other medical conditions that can reduce your count.
So, Doc, how do we diagnose some of these conditions?
Yeah. Ideally, what we say is that if a couple stays together for a year and there's no conception, they need to be evaluated. And evaluation means the man and the woman. And in actual sense, the male zone is the simplest to do. All you have to do is to come and produce a semen sample for us to look under the microscope. And there are some parameters that we have to look at that would say that sperm is within the normal range or not. So we look at a few things like the count of, the number of sperm that you have, the shapes of the sperm, because the sperm is supposed to, I'll show a picture of how the sperm is supposed to look like. Then the movements. So this is basically how a sperm looks like. It's got a head, it's got a neck, there's got a middle part and a tail. So this is what a normal sperm looks like. But some sperm will have maybe double heads or triple heads. Some will have no tail at all. Some will have no head at all. Wow. All these sperms are unable to fertilize an egg normally. So there are a few parameters we look at. We look at the count, which ideally should be about 15 million per ejaculate. Okay. Then we look at the motility, how the sperm is moving. Are they moving in a straight line? Are they just lazing, sitting at one place, just wriggling the tail? You know, at least 32% should be moving in a straight line, in a progressive line. Then we look at what we call morphology. Morphology is the shape of the sperm and all that. It's supposed to have one head, one body, one tail. So if at least you need only 4% of the ejaculate to have normal morphology. So that should be at least very easy to have. Out of millions, only 4%. So these are the main ones. Of course, there are other things, the volume, the pH, and liquefaction. But the main ones are the motility, the morphology, and the count. So we look at these. If the count is more than 50 million, if the morphology, at least 4% looks normal, and the motility, if at least about 30% are moving in the right direction, then we say, yeah, okay. To produce the semen for examination, you would have to abstain a few days. Normally, we say 3 to 5 days. If it's less than 3 days, the quantity might be too small, or the sperm volume might be too small to evaluate. If you stay longer than 5-6 days, a lot of them might be dead and all that. So we give you instructions, you abstain for 3 to 5 days, then you come and produce the semen sample. Ideally, we want to produce in a hospital, because if you produce it outside and you have to bring it, if you don't get it to the hospital within 30-45 minutes, the parameters might change. And it's produced by masturbation. Most people will say they will not be able to masturbate, or it's against their religious beliefs and all that. Those patients, we can get them what we call non-spermicidal condoms, so that you could have sex with your partner wearing a condom. Then once you ejaculate, we take the sperm sample and look at it under the microscope.
And it doesn't affect the quality of the sperm?
No, that's why we say non-spermicidal, because some condoms are spermicidal. Those are going to reduce the quality. So 1, you have to abstain. 2, we want it done in the hospital. If you can do it in a nearby guest house and bring it in 30 minutes, that's acceptable. So you put it in a container that we provide for you. Basically, that's all the man has to do.
But it's not that simple, is it?
Why not?
For a man? What's your experience for the men?
It's not simple, not for the production, but to get them to come.
Okay.
But if you get them to come, for most of them, it's a very simple procedure.
Okay.
Some for religious reasons might say masturbation is against their, or some would say that they don't like the environment because it's a hospital and everybody knows what he's doing in the room. But once you get them to come, that aspect is not really a problem. It's getting them to come that is a problem.
Okay, so now we do the semen analysis and there's a problem.
Yeah.
What treatment options are available for men? And from your experience, how have they reacted, to such treatment options? First of all, how have they reacted to the diagnosis? And then how open are they to the treatment options?
From my experience, a lot of men don't seem to accept the results. Okay. Most of them will give you reasons. So when I was in secondary school, I impregnated somebody here. I've impregnated somebody, so he doesn't believe. And he knows he's a man. That's what most people will say. I know I'm a man. Why are you telling me this and all that? So a lot of them don't take kindly to it. In fact, most of them would quietly come and look at the results before they bring their partners. But when the partner is coming to look at the results, they come along. But when it's their turn, they want to come and check and be sure everything is fine. And most of them will even ask for a second opinion, trying elsewhere or go and bring another analysis. In fact, I've had experiences where a patient made the brother to produce a sperm for the test, just to show that everything is fine, because he had done it before and he knew there was a problem with it. So he got the brother to, because in some labs, they just direct you to the room to go and produce. And of course, they don't know whose name is on the request form. So I had an experience like that. And when we repeated it, there was virtually nothing in it. And later he confided that, that the first one was his brother, and he didn't want the wife to know. So a lot of men don't take it easy. It's a bit of a blow to the masculinity of a man that he's the reason, because all the while the in-laws and everybody's blaming the woman, and all of a sudden it's him. And it's difficult for a woman or a partner to also go around telling family members that, look, the thing is your son. It's my husband whose sperm is a problem, because it kinds of, men is all about machoism, and if you hardly will see a woman telling other people that. Maybe she might confide in a friend or a doctor or something, but to say it to relatives that, but the problem is actually from my husband, no.
Is it a cultural thing, a religious thing? Where is that coming from?
I think it's a cultural thing, because when a man realizes that he's unable to father a child, I think it really affects the ego. And psychologically, a lot of people cannot cope. And if you've been to lorry stations or drinking bars and all that, the biggest insult they can give is that, why would that? So no matter your stature in society, in terms of men, once you haven't fathered a child, they still don't consider you as a man. So that's where the stigma comes from, and people don't want to talk about it. He will come once he sees the results, he might never show up again. I had a patient, when we did analysis, there was no sperm at all, zero. And he warned the wife never to come and see me again.
Oh, wow. The wife shouldn't come to you again.
Because I don't know what I'm about.
How is that your fault?
No, I don't understand.
What you are doing.
Fertility.
Oh, my goodness.
And it took 3 years for the wife to call me and tell, Dr. Homiah, I'm sorry, I know I have to come, but my husband has warned me that if I step there again, there's going to be trouble. So it's a whole big... Women are coming all the time to have their issues addressed, but the men, most often, these days you are getting a few men, coming for the initial, and once they see that theirs is fine, Doc, mine is fine, okay, that's it.
That's it.
It's gone.
They are done with you. Everything else becomes the woman's fault.
Yeah.
Wow. So for the few that are willing, to subject themselves to some form of treatment, what kinds of treatment?
Well, basically, about 20% of the time, just lifestyle modifications can help.
Okay.
Weight reduction, eating the right kind of stuff, avoiding alcohol, cutting down drastically, stopping smoking especially these recreational drugs, taking some vitamins. Most often, one thing about sperm parameter is that it changes, it could go up today and come down the next.
Oh, okay.
So with lifestyle modification, most people after 3-5 months would be all right. Some have genuine problems that would require assistance. If it's a problem of erectile dysfunction or premature ejaculation, there are medications to help, or you could collect the sperm and actually inseminate the wife if the sperm is being produced in the wrong direction. Some people, when they ejaculate, it goes back into their bladder, especially people who have had prostate issues and all that. So those patients, you could collect the urine and pick the sperms out of it.
I see.
You know, for those that are due to obstruction, normally this is where the sperm is produced.
Okay.
The testis, and it's stored here in the epididymis. Okay, so during ejaculation, it comes all the way from here, then it comes out. So any obstruction along any of these routes, no sperm will come out. Okay, so sometimes because of gonorrhea and other infections, there could be obstructions along the way. There are surgical methods of bypassing the obstruction. The worst case scenario is that we pick the sperm from the testis.
Okay.
There are procedures to pick it from, we call TESA, testicular sperm aspiration, where we put a needle into the testis and take out some few sperm and use it for what we call ICSI.
Okay.
You know, so there are so many things that can be done. For very few people with their genetic problems and all that, that is where sperm donation might come in, adoption, or preparing for childlessness.
Now let's talk a bit about that. First of all, how open are men to treatment options in your experience, and then I will talk about donor sperm.
A lot of men make an effort once they realize there's a problem. And the wives sometimes have to be on them, especially if they have to take medications, if they have to stop alcohol, if they have to stop smoking. The wives do well with that. Sometimes you need a surgical procedures to bypass the obstruction. There's something called varicocele, where there are big veins here. The testis is outside for a reason. The temperature should be lower than the temperature of the body.
Okay.
So it should be at about 2 degrees lower than the normal body temperature. That's why God hangs it outside. So that is why people talk about having tight underwears and sitting for long hours, driving long hours and all that. The previous cars, which they had the engine under the all those things used to, yeah. So these are lifestyle modifications that can easily be done. The surgical options, some men would want to have it because for a lot of men, donation is out of the question. For a lot of men, if you take 100 men, donation might be about 2 to 5.
Oh wow, that's serious.
Yes.
Why?
Well, it's obvious that probably for them, the child is not
It's not theirs.
theirs.
And they cannot accept it.
They cannot accept it. There's always a fear that one day the woman will say that, look, the kids are not even yours. I'm taking my kids away, you know. And of course, it's not an easy thing to accept because everybody wants to have his genetic material propagated. So that's why we all have children and all that, you know. So we propagate our genes. So it's not an easy thing even for the female to use a donor eggs. So for a man too, it's a bit difficult. It's quite difficult. It's more difficult for the man than for the woman. Rarely some would accept that, look, he knows there's nothing that can be done. Let's go with that.
So with the donor sperm, typically, how do you go about it? Because I've heard cases where people would bring their family members, or they can buy sperm, or how do you go about it?
Yeah, I mean, it's open. You can bring your family member, you can bring a friend, you can there are sperm banks where
Okay.
the sperm is stored already. Most people don't want to bring family members and all that, and most often the wives will not accept a family member coming to. They would rather an anonymous sperm donation than a family member. Um, Sometimes people might tell you, "Look, I want to bring a friend," and all that, but of course your wife has to sign for it because she's also part of the whole. So 90% of the time is anonymous donation. The sperm bank, we look at some of the features that match a bit to either the man or the woman blood group. Of course, they've been screened for genetic diseases, infections, and all those stuff. Then those ones can be used for the procedure. But it's rare.
It's rare.
Yeah, but because of technology, you don't really need sperm donation much. Once there's sperm in the testis, you can find some to fertilize.
Okay.
So it's only the ones with pure genetic problems that they don't produce sperm at all that might require sperm donation.
So let me understand that. That's oospermia, right?
Isospermia, that's zero.
Oospermia, zero. So for those ones, there is no way they can produce sperm. There's no medication. Yeah, you cannot,
No, it depends on the cause.
Okay.
Somebody could be isospermic because there's a blockage here.
Okay.
So the sperm is here. So you can get a sperm from here. But if it's isospermic because there's no sperm being produced here at all, that is when you would have to go for donation if the person accepts.
So, do you have any, knowing the fact that men, it's difficult for them to accept, and psychologically, their ego and all of that, do we have any support for men prior to, breaking the news to them or after you break the news to them?
Oh, personally, what I do is most of it, when you're taking the records for any consultation, you take both the husband and the wife or the emergency number if there's a problem, who to call and all that. So I tend to encourage the men that, look, when you show them these graphs that it's not your problem or it's not a Ghanaian problem or it's nothing new. It's a global phenomenon. The fact that your parameters haven't reached what the WHO says is normal doesn't mean you cannot get a woman pregnant. You understand? All we are doing is trying to enhance it to make it better. But even with low counts, a woman can still get pregnant. Because sometimes fertility is a combination of the two. The woman could be so highly fertile that with even a count of 100,000, she could get pregnant. So there's no point looking at lab parameters alone and say that because of this, I can't impregnate. Even during the course of treatment, I always encourage them to be having sex at the right time and all that. But sometimes what they tell you is that, what's the purpose of me having the sex if I know that nothing is going to come out of it? But you'll be surprised that along the line, a lot of women will get pregnant, even though the husband has very low counts. Because we are talking about millions, and if you're working around 100,000, 200,000 and all that, one lucky sperm could always, impregnate, find an egg and impregnate it. And of course, there are so many technologies now to help with male fertility. So I always tell them that, look, come, there are solutions to these problems. We can always find a way out, And even the way you describe the results to the woman gives her encouragement. You don't let it sound like, oh, it's your husband's fault. It's not his fault. It's a combination. You're trying to, the two of you, maybe you just have to make extra efforts. Unlike the typical person to get pregnant, you might have to do a few things more. That's all. And most women will get pregnant. And surprisingly, the women are very understanding when it comes to this aspect of it. They are patient. In fact, some of them will serve the medications to the husbands every evening because the men might not take it.
Women, thank you. God bless you for supporting your husbands, go through this. And yes, the men might not take it. The malaria tablets, they don't take it. So I can imagine.
Yeah.
Okay, so there are men watching you. What advice would you give to men? I mean, man to man, doctor to man. Because we are, and I know of cases where men have just refused to accept, burying their heads in the sand and living their lives and trying to impregnate every woman just so he feels he's a man. But it's not happening. Please talk to the men.
Well, first, what I'll say is that fertility treatment all over the world now is for the couple. In fact, there's a hospital I went to in Belgium some time ago. If you don't bring your husband or the husband doesn't come with you, they don't even start the evaluation of the woman at all. Well, but they are single women. And it's a confidential procedure. You do the sperm. If there are problems with it, we discuss it. Sometimes we can even discuss it man to man without your wife being present. Then we can pass on the information to the wife in a way that she would understand it. Because for the typical non-medical, if you see the parameters and go to Google it, the first thing would be that my husband is infertile. It doesn't necessarily mean so. There are a few parameters. Maybe that time, in fact, we don't even use one semen analysis to draw a conclusion. We have to repeat it after a month before you can say that it's low. It could be low today, it might not be low the next. And the fact that it's low and it hasn't gotten to it's just an estimation that if somebody has this kind of count, is most likely going to impregnate a woman. It doesn't mean that you always have to be at that point to impregnate a woman. It's a statistical analysis that with these numbers, a man is likely to impregnate a woman. But it doesn't mean that if it's 1 million, if it's 2 million, 500,000, nothing can happen at all. And of course, we have to take a bit of responsibility. Alcohol is something we can cut off. Smoking is something we can cut off. Exercise is something we can do. Eating right is something we can do. I mean, it's difficult now in the system because you are moving but you can always make an effort. Vegetables, contumely, and all these. Avoid fatty foods. I don't know, junk food and all those stuff. And after of course, it's not even for the sperm alone. It's for your own health, long-term health too. So if you have diabetes, it can be controlled. If you have hypertension, it can be controlled. And once all these factors are controlled, most often you realize that there's pregnancy without any assistance at all. Yeah.
So being diagnosed with infertility as a man, it's not a death sentence. From what Dr. Homiah is saying, there are so many treatment options. And sometimes just lifestyle changes, could reverse everything. Today we are talking about male infertility and the fact that it takes two to tango, and also appreciating the fact that it is difficult for men to accept, when they have issues with their fertility. But today we are learning that it's not the end of the world. The man has to embrace, the reality on the ground. And once you do, usually you get the woman's support, and together you would work towards it. I know there are some women who may not be supportive. How does that play out?
To my surprise, I hardly get women who are not supportive in this sense. I hardly get. They become unsupportive when the men refuse to conform to the medical advice or medications that are being given. Stop drinking. He's not stopping. Stop smoking. He's not. And he's trying his luck outside to come and show that these are things that emotionally low woman can withstand. But on the whole, I think women are very, very supportive when it comes to, I don't know what happens at home, but at least in the hospital, I know they are very supportive. They encourage them to take the medications, stop drinking, stop smoking, and all those things. They are very supportive. You cannot take away from the women.
That's great to know, because whether we like it or not, it is not an easy thing to take as a man. Yeah. It's not an easy thing. So we want to round up the conversation. We have been speaking with Dr. Joseph Homiah. He is a fertility specialist with Accra Fertility Centre under the Medifem group of hospitals. And for me, the key message has been male fertility is critical, especially in our world today. But it is important for us to talk about it. When couples are struggling to have babies, it's important to go together to the hospital to get help. Because, first of all, diagnosing male fertility is way easier and it's less invasive than the path to diagnosing women infertility. And so I want to encourage everybody out there, if you are a woman, don't be afraid, to encourage your husband to seek help together with you. And if you're a man, you have a friend who knows a friend who knows a friend, please encourage them. I think men should begin to talk about male fertility and not shy away from it. It doesn't make you any less of a man than you are. So, on that note, I want to say thank you, Dr. Homiah, once again for coming and for helping us understand this whole mystery about male infertility and helping us know that it is possible. And we are grateful that today we can, learn about these things, and we can also pass on the knowledge. And so, when are you coming next?
Anytime you want me to come. Anytime you want me to come.
Thank you, Mahogany Consult, for the production. Thank you, Nunua Skincare, for the support. Thank you, JUPAUL Organics, and JUPAUL Makeup for my lovely makeup and accessories. And thank you to the crew who are always behind the cameras and doing a wonderful job. I'll see you very soon. And please continue liking, continue sharing. We are on Facebook, we are on Instagram, on YouTube, we are on TikTok. So please keep sharing. Thank you. Bye.
Live, move, and have your being with Baaba Cofie.